According to the Human Rights Watch, hunger, malnutrition, and severe food shortages became widespread nationwide. Pediatric wards began to fill with severely malnourished children, a condition rarely seen before the economic crisis. Doctors reported hundreds of child deaths linked to malnutrition, yet the government responded with a near-total blackout on health statistics, discouraging medical staff from documenting cases or deaths related to government failures. Between 2008 and 2013, undernourishment affected less than 5% of the population, but by 2015 to 2017, the number had more than doubled to almost 12%, or about 3.7 million people. A 2016 survey revealed that nearly three-quarters of the population had lost an average of 8.7 kilograms due to malnutrition. And in 2017, 64% reported losing about 11 kilograms. A 2017 poll also found that nearly half the population could no longer afford 3 daily meals. The government, however, blamed the crisis on an alleged economic war waged by the opposition. Water access compounded the crisis, and a 2019 United Nations report estimated that 4.3 million Venezuelans needed water and sanitation assistance. Following the massive 2019 blackouts, 2/3 of the population, or about 20 million people, were left partially or entirely without water. Without access to clear water, diseases surged, including diarrhea, typhoid fever, and hepatitis A. Hospitals also saw a rise in postpartum infections linked to poor sanitation. By 2017, around 75% of Venezuelans had lost over 8 kilograms due to hunger, and over half lacked sufficient income to meet basic food needs. In March 2019, the United Nations estimated that 94% of Venezuelans lived in poverty, and by 2021, nearly 20% of the population, or about 5.4 million people, had fled the country. The country also faced rampant violence, with a murder rate of 81.4 people per 100,000 people in 2018, ranking Venezuela as the world's third most violent country. Following mounting international sanctions in 2019, Maduro abandoned many of Chavez's policies, including price and currency controls. This policy shift led to a temporary economic rebound before the COVID-19 pandemic hit. Amid the devaluation of the bolivar, Venezuelans increasingly turned to US dollars, which Maduro referred to as an escape valve that boosted the economy. Nonetheless, Maduro insisted that the bolivar remained the national currency.